Hey, good morning. This is Steve Stites, Chief Medical Officer at the University of Kansas Health System. I'm broadcasting not from the Dolph Simons Family Studio this morning, but from the Hayes Medical Center campus, part of the University of Kansas Health System, and delighted to be here in Hayes. I am joined this morning here in Hayes by Eddie Herman, who's our hospital, the head of the hospital here at Hayes, and also Dr. Heather Harris, who's the medical director here at the hospital. Of course, back in the studio in Kansas City, Kansas, is the ever-faithful Dr. Dana Hawkinson, Hawkeye, our medical director of infection prevention control, and he's joined there by Dr. David Lisbon. David, welcome back to the program. David is one of our outstanding emergency room physicians, and David has a special passion for helping us look at the social consequences of the pandemic. So this morning we have a great program. We're going to talk about things both in Hayes and Kansas City. We want to make sure that folks understand what's going on in rural America, rural Kansas, so close here to our home in Kansas City, Kansas. But first, more congregate, not just living, but people coming together, whether it's schools or colleges or bars or churches or what have you. So we're going to watch those numbers really closely because it does make us just a little bit nervous about what's going on. Heather, how are the numbers here at Hayes today?
Yeah, so we've climbed too as well. We have 16 inpatients. We have 14 that are actively sick, 2 that are recovering, and we have no ventilated patients as of this morning. So we've also taken an uptick on some inpatient folks and patients. And we have a combination, we serve 23 communities. So less than half of those are Ellis County, but we service a huge county space, so we've got folks from all over.
Yeah, well, that's a great point because you guys are such a referral center for Western and Central Kansas, and so I suspect you're going to get patients from all those.
Have in the hospital.
You bet. And we talk about masking and distancing, and just to say, we're more than 6 feet. Put your arms out here, people. We're a lot more than 6 feet apart, so we made sure we were far apart in order to do this and to be safe. And there's a lot of good ventilation in this room, so I can feel it on my head right now, my bald head, but I'm not as bald as Eddie. Heather, what is your sense? Are they starting to get that message? Gosh, this is real. It's real here in Hayes, just as it is in Kansas City. As I know it's become late to Ellis County and to Western Kansas, but man, you can feel that uptick.
Sure, because I think everyone now probably knows someone who's been sick with it. And as well as they may have had a family member who's sick and had to struggle with the morbidity and the longer the hospital stay. So, yeah, no, I think people are understanding that the virus is here and that it, can take some consequences.
Yeah, it really can. And I think those consequences are real. They're real both medically and and for both our physical health, but also our mental health. You know, pandemics are hard. And again, for some of us who are older, this is our really second major pandemic in the United States. I was driving out here yesterday with Bruce Toby, who's the chair of orthopedic surgery here, and you know, at Bruce's point, we were talking about how AIDS was really
point. And from an economic standpoint, I know patients have commented on, you know, how tired they are of this, how it's affected some economic well-being, even people who have been evicted, and how that's kind of playing and making some of their medical conditions worse, particularly those with a underlying anxiety condition, excuse me. I've seen a number of patients who really felt like, wow, because of some of the economic stress, I'm not able to perhaps pay rent or provide other support for family members, and that causes their anxiety to perhaps be much more stressed. And in addition, even the aspect of perhaps having an interruption in medicine delivery. So that fourth wave, I think, is something that we're all experiencing now, and it's a real it's really something that's becoming manifest even inside conversations with patients. You know, one of the things as people have around the country have looked at this graph, and it's spoken to what we've seen with coronavirus, the question of how it's affected people personally and professionally. You know, myself, I can certainly say that it's tried certain parts of my patients as I continue to, of course, try to be a good citizen, wear my mask, be careful about events that bring lots of people So it's actually caused me to try to sharpen, you know, what we call our clinical acumen, and make sure we're looking at the complete patient, and perhaps not giving the coronavirus such an elevated place in our thinking in terms of the diagnosis, if that makes sense to you guys.
I think it does. I think you're right, because you got to be careful that we don't miss things because we get so focused on coronavirus as well. And David, you know, one thing we know is that this virus has taken aim at certain communities more than others, and so especially for minority communities and for first responders, for frontline workers, for people who really can't afford to take a day off, this has been an especially difficult time.
Yeah, Steve, once again, you know, you're right. I not long ago gave a lecture to our graduate medical education department residents and fellows about health disparities. And just once again, as you said, thinking about perhaps the triple whammy of someone who perhaps is an essential worker, perhaps in a meat packing plant or
have plenty of beds for patients who are sick.
Absolutely. Yeah, no, we've got plenty of beds. We can get tight on staff at times. We have different places we've expanded outside of our COVID unit for those that are a little less sick. But no, we've got plenty of beds, and we continue to be inventive with staff working long hours and working really hard to care for all these patients. So we do, we really don't want more folks being sick. So we want people to keep, doing the social distancing and wearing their mask and trying to keep staying healthy so that we can continue to keep the burden of patients limited here at the hospital the best that we can.
Yeah, I think those pillars of infection control, they follow you wherever you're going, whether they're in Hayes, whether you're traveling to Hayes, or whether you're here, it's mask up. And again, not mask up at the moment because we're pretty far apart. Eddie, from the standpoint of the community, do you feel like there's an increase in mask wearing and people following those pillars, not as much congregate gathering? How is that playing out here in rural America, in rural Kansas?
Yeah, I would say that we've seen, especially here in our area with the mask mandate that we have, as well as everyone's seen that national companies have gone to where they're not even willing to have people come into their stores because it puts their people at risk, which we have to all understand. And that you go to Walmart to get groceries, or you go to Dillon's or someone out here to get groceries, if you put the people that work there at risk, and then we put ourselves at risk at not having a place to go and get that. And so I think people are really starting to understand that wearing a mask is for
We do. We have one reporter question from KCTV 5, and it's around Halloween. They're wondering what's safe, what's not safe. What are your recommendations?
Well, I think the safety grows if the Halloween costume includes a mask, Dana Hawkinson. What do you think?
Yeah, absolutely. A mask, the outdoors for sure. The CDC has recently put out guidelines for Halloween and for Thanksgiving. I don't have any inherent problems with those. They again go to the basic concepts that we've been talking about.
Of a normal life as you do that. I think that's probably the right thing to do, Jill. What other questions do we hear this morning?
mom wants to know, she uses a nasal rinse twice a day. She's wondering, A, does it help me with prevention of COVID? And 2, if I get COVID, will the nasal rinse somehow affect the test?
Well, Hawkeye, I don't think we have to worry too much about that. We have plenty of virus being shed. People use all sorts of things, and as somebody with patients who have cystic fibrosis often have a lot of nasal issues, unfortunately, rinses may help get rid of some of the antigen in the front part of the nose, but the swab goes back a long way. Don't think you're going to fool a swab and you're not going to fool a spit test. Saliva test, just because you do nasal rinses. What are your thoughts?
Yeah, so there's been no really validated means of prevention by using nasal rinses. We've heard this on the show sometimes. Sometimes it's certain chemicals that they're using. I think this
Let's go around the table a little bit. You and I and Dave and Hawkeye, we're going to take this one on. What are your thoughts?
All right, so I hear this story a lot. You know, we're in a town of college students. We have friends that have college students. They went away, had a good time, came home. Some of them have the virus. So, boy, if you can invite them back into the home and have dinner with them, but maybe pick the long table at home.
Yeah.
And try to do some social distancing when he's home. You know, have him use his own bathroom because he certainly could be carrying the virus. I'd also, really try to avoid visiting the 80-year-old grandparents too. That's the group that always kind of makes me a little nervous.
I'm with you.
So particularly, depending on how healthy our person is too, that would make a difference on that visitation as well.
David, what would you say? You don't want those people to come into the emergency room. What are your thoughts?
Oh, we're always glad to, do what we can to help in this situation. I kind of echo Heather.
I know you are.
I think the biggest risk would be to those he's coming into contact with that might be immunocompromised in any way. That would be my biggest caution. And, I think I have children in that age group myself, and they've all been tested once out of just concern about the virus. Some of that will depend on how readily available testing is. But it might not be the worst strategy to alleviate some concern and then also be able to foster the chance to maybe make important connections, knowing that at least it's in some window the person or the individual is COVID negative. But again, it's a once again one of those risk-benefit things. I think the biggest issue is the caution to who else he might pass the virus on to.
Yeah. Hawkeye?
Yeah, I agree. We see this happen every day. I do have some family friends who recently got diagnosed with it, including mother, a child, and grandparents, because there was a young person who came home for Labor Day weekend to spend time with the family. And that, when that person came home, where she was from, in college, there are cases there. And so now the whole family has it, essentially. And so those things absolutely do happen. And we are talking about young people, so basically 30 and below, and especially if you are hanging out with people who are maybe not regularly in your bubble, but also just hanging out doing the things that was discussed in the question, you are at risk. So I think taking some of that physical distancing when you're in the house, can you isolate or quarantine for some amount of time for that? Can we get testing? Depending on who you call and where you go and the reason to test, you may or may not be able to get testing, but we don't know exactly when to do that. Is it going to be, after you've been home for 10 days just to see if you're negative? I think you need to continue to take those measures of the public health guidance of the distancing, maybe masking in the household as well, because as Dr. Lisbon said, it is ubiquitous. It is out there. We see stories like this all the time. So taking those types of precautions, especially if somebody is coming in from out of town, may be the best way to protect yourself and your family.
Yeah, I think that makes a lot of sense. So here we are in Hays, Kansas, and I got my bubble at home, and now I'm intersecting with Heather's bubble and Eddie's bubble, and yet we're more than 6 feet apart. To your point about the long table, Heather, we're staying apart. The wind's blowing in this room as I can feel it. That's going to move all those viral particles around. Makes me feel pretty safe. Now, my daughter came home in June, and she's from Chicago. She lives in Chicago. And I think she does a really good job. She's lovely. She's a great kid. And well, she's not a kid. She's 30. And so, when she first came in, I was like, okay, I'm going to wear a mask, and we're just going to stay socially distanced. And that lasted for, like 5 minutes, and I gave her hugs. Like, she's my kid. I'm going to give her a hug. I love her. So how do you handle that? I think the answer is you have to establish what your risk tolerance is. And here's what we did do. My 88-year-old mother-in-law, now 88-year-old, she was 87 when this program started 6 months ago. Now she's 88. You know what? She couldn't be in the room because I can't put that, to Heather's point, you can't put her at risk. I'm 60. Should I be put at risk? I don't know, but I can accept that risk personally. Don't know that I can project that onto my 88-year-old mother-in-law. So at the end of the day, you have to decide what you're going to be and what you're going to tolerate, and you have to have a conversation about that as a family, and you have to make wise choices. And remember, the more comorbid illnesses you have, the older you are, the worse your potential outcome. To David's early discussion about this pandemic and its effects on our mental health, and then you have to weigh those physical health things with your mental health, and you have to make a decision how you're going to do it. My decision was I was going to hug my daughter. And you know what? She's going to come home for Thanksgiving. She's driving. You know what? I'm going to hug my daughter. But I'm also going to have her get a negative COVID test before she leaves.
I think the other thing is I see over and over again in the clinic is that patients in hindsight sometimes don't feel good. They go, I wasn't feeling that good, but I went ahead and went to that function, or I went ahead and went to that work. And you can tell, and hindsight's great, right? But if people really will take a moment to really appreciate that they really maybe are kind of sick or not feeling their best that day, let's see what that looks like and kind of get away from those people, because we see it over and over and over again. If people might have just taken a little time out for that day, it might have avoided exposing a bunch of other folks. So keep doing the best we can.
Yeah, it really is true. Monitor your own symptoms. If you're not feeling great, don't think it's just something you don't need to worry about.
Especially young folks. This kind of looks like a cold to them.
Really
they don't
does.
get very sick, which I'm very thankful for. But
yeah. Eddie, what are you going to do with your family over Thanksgiving? You got a plan?
Yeah, I think that's one of the conversations we're having, is because we have a large family, and so are we all going to travel and get together, or are we just going to keep it to more of our just localized family that we've been around before and we know, and they're kind of already in our bubble?
Yeah, that's a conversation we're all having. Okay, Jill, what else is out there?
Earl wants to know, if COVID symptoms have ceased, does one have to still distance from the family? And also, Earl wants to know, how long does the virus stay in your body?
Yeah.
Well, yeah, that's a good one, Hawkeye. We know that after about 10 days, it's pretty unlikely that you shed virus. And so that's kind of our rule. 10 days and no more fevers, and you feel substantially better. I think that's a pretty good sign that you're not shedding active virus that's going to infect others. What do you think, Hawk?
Yes, absolutely. The best data that we have, and it is a few studies, so it's not a lot, but the best data we have certainly is that by 8 to 10 days, you really aren't able to culture any infectious virus from the upper respiratory tract at that time. And so that is really why the CDC has landed on that 10 days since the symptom onset is when you can discontinue your isolation. But that doesn't mean that you can't or do the same things that everybody else needs to be doing, such as masking, distancing, not congregating in large groups. So it is about that 10-day period from the symptom onset when you can get back into society and be back with people. But you need to continue to do those public health measures as well.
Heather, what do you say to your patients in the clinic with that kind of question?
Absolutely, every single
Heather's
day.
a family medicine doctor, just so you know, so she gets these questions all the time.
I'm on the phone every day telling everyone, so I can almost recite it by word. But absolutely, I tell them stay home from 10 days symptom onset. As long as at the 10th day you have no fever for 24 hours and you're feeling tons better, is the word I use. As long as you're feeling tons better, then you can go back to live your life and go to work and do your thing. We're not, obviously recommending testing after the 10 days because we do feel that there can be some of the virus particles picked up, but we don't feel like people are infectious. So we're still teaching that curve. We're still having a little bit of challenge for people wanting to be tested after their 10 days, but we're not recommending that, nor is the CDC or anyone else at this point. And we've been real successful with that. And honestly, young folks are better within about 5 or 7 days, but we really encourage them to stay home for the whole 10, and everyone's been doing a great job of that.
All right. Next question, Jill.
Krista wants to know, why don't you advise all people to wear N95 masks? Because after all, they protect the wearer and other people, right?
Well, they do protect the wearer and other people. They're also hard to come by. They're a lot better than they were. They cost a fair amount of money, and we don't want to put a run on all the N95 masks in case the outbreaks are in the hospitals and health systems. And Dave, I'm going to turn to you in just a minute, and Hawk, but I think this is a great question because people are going to want to wear N95 masks. And I was stopped on the road yesterday to get gas, and after we were filling up the car, went inside the convenience store, and there were N90, or actually they were KN95, which are a little less effective than a true N95 mask, but they're for sale in the convenience store, so there are more of them out there. And I think if people want to buy that and wear that, they can. But the reality is, if you follow the other rules like distancing and mask wearing, you're going to be fine. And the proof of that is inside hospitals. And I bet Heather can comment on this as well. What we know is that inside the hospital, following standard infection control measures, which include wearing goggles and a standard surgical mask, which is it's a little better than a cloth mask, but it's not an N95 mask, that our staff are not getting sick. Now, if they're going to go in front of somebody and having to do what's called an aerosolizing procedure where there's potential for a whole lot of viral particles going in the air, then they're going to wear an N95. But for the most part, it's a standard surgical mask. And that keeps people sick, Hawkeye. I'm sorry, that keeps people safe, not sick. Keeps people safe, Hawkeye. So I really think you can be safe with a standard surgical mask. What do you think?
Yeah, absolutely. And I'll let David comment as well. I am one of the few people in the hospital who actually is not fit tested for an N95. We have to remember that in the healthcare setting, you have to be fit tested for an N95. That means people have to make sure that the seal is good so that it actually does what it's supposed to do. The ones you buy out in the hardware store or the convenience store, they may be N95 or KN95. It should provide protection, but again, in the healthcare setting, you need to be fit tested. I am not fit tested for one. I'm one of the few people in the hospital who aren't. I do just use this in general. And just as you said, those masking in the community, the 2 to 3 layer cloth masking are probably sufficient, as well if you are distancing, not congregating in large groups. Hopefully not spending a lot of time inside in those settings as well. And I don't know your thoughts as well.
Yeah, Dana, you're right. I use myself as an example of somebody who is primarily using the surgical mask. I think that is a very good blocker of virus. I think there's a graphic out there somewhere that the CDC has done, and it just shows how little transmission there is if 2 people are wearing the mask, and then if 2 people are wearing the mask and 6 feet apart, how minimal the transmission really is. And so to Dana's point as well, I think I try to pass on the fact that what you might see at a convenience store and what somebody may be hawking is the thing to have a KN95 mask. It's not quite the same, and that you'd be better off properly using a surgical mask to ameliorate your exposure to virus. So that's what I do. And of course, like Steve said, when we get into the settings where there's a high probability of COVID and or aerosolizing procedure, we don up and get completely ready. And so although that proves sometimes tiring, but it is a necessary thing. So.
And Heather, from your standpoint with your folks, I'm betting you're saying the same thing.
Absolutely. And I think the other thing that we do as healthcare workers, at least I know I do, and I see it all throughout the hospital, is we wash our hands all the time. And I don't know that, when you're running around town all the time, if you're really washing your hands. Obviously hand sanitizer works great, but at a minimum, I'm washing my hands twice for every patient before I see them and when I'm done. And, I think everyone around the hospital is doing that too. So I think that's another valuable process and practice that will mitigate, the contact of the virus. So I really encourage a lot of hand washing.
And Eddie, from the standpoint of just supply, I suspect that there were a problem with PPE at first. How are you guys doing here in Hayes now?
Yeah, we've got an adequate supply. That's one of the benefits of being in a system is we've had the ability to go out and do some big bulk purchases to make sure that we can continue to have PPE to do surgical procedures. That's part of the N95 equation too, is we really need them where we need them, and we just don't know yet whether we're done needing them or if we're going to need even more to move forward.
Yeah.
And we need those for those patients who have emergent and urgent needs.
And I would just say, if you put on an N95, guess what? The rules of infection control and social distancing, they didn't change. So you put on a less comfortable mask that if you don't have fit tested is really not better than a surgical mask, and you still have to follow all the same rules. So I think that the proof is in the pudding. I don't know about pudding, but the proof is in the pudding, because in a hospital where we're wearing surgical masks, we're not spreading COVID-19. So I don't think you need to wear an N95 unless you're going to be in an aerosolizing procedure. I'm going to go operate on your sinuses. I'm going to stick a big a tube into your nose. I'm going to have you do a breathing. Things that we know cause the virus to have a higher concentration as we exhale, or when we want to have an N95 mask, Jill.
All right, Janelle, she had COVID 5 weeks ago. Now her son has had an exposure. If he ends up positive for COVID, she wants to know, do I have to quarantine again?
Well, that is a great question. First of all, we hope you're recovering well from it. And as we know that those COVID symptoms can hang around for a while, our earlier listener had asked, is the virus still in your body? And I meant to qualify our answers, because we all said we think after 10 days you're safe. You may still harbor a little bit of virus, but more than that, you may still harbor the complications of having had that virus, and you can stay sick for a while. What we hope is that those antibodies, both the type that your body produces and some things your cells secrete, what we call humoral chemicals for our body that will help us fight against COVID, hang around for quite a while, and up to 3 to 6 months. So therefore, for somebody who's 5 weeks out, we're hoping that you won't get the virus again. But Dana, we don't know that that's 100% true, because that's not really something we've studied. And this COVID-19, this SARS-CoV-2 virus, it acts differently than other viruses.
Yeah, I agree with you. And especially to your first answer, we know that there are some viruses that hang around in our body. They get incorporated into our genome, things like HIV, CMV, HSV. I think we all know about varicella, which causes shingles. So that is many, many years after somebody has had chickenpox, they can get shingles. It's the same virus. That's because it is hanging around in our body. There's no evidence that this nor any other common coronavirus does that in our bodies. So, I think moving forward, there's really no good guidance on what you should do, especially if you had it 5 weeks ago. That's pretty close to the acute infection. You should have some durable immunity at that point in time. We certainly do not recommend, really testing at 90 days, and I'm almost recommending pushing it out to 120 days. Again, there's no data. That is really based on the 2 cases of reinfection that were seen about 140 days after the first infection. So I don't really believe you have to quarantine. We can certainly look for that specifically, but I don't believe there's a lot of good guidance in there. You should still try to have that other person isolated, though, and continue to do those other non-pharmaceutical interventions, such as the distancing, masking, hand washing, and things of that nature.
Yeah, good stuff. All right, Jill, we just have time for a few more questions. So,
all right, Karen wants to know, you've mentioned long-term side effects for some, even with mild cases. Her question is, if I'm asymptomatic, do I have a risk of maybe developing some chronic or long-term problems later on?
I think the answer to that is that we don't really know. We believe that even somebody with asymptomatic, though, can develop long-term complications related to blood clots and related to heart inflammation. And I think it's going to be clear that the risk of complications, as we study this over a period of time, I think the risk of complications will be much more likely in people who have more severe disease. And remember, the most severe complications we were worried about are lung disease, because you can get significant scarring in lung, heart disease, because it can cause inflammation and weakening of the heart muscle, problems with how well you think, because it can get into your brain. It can also cause blood clots. It can also cause some liver and kidney injury. So lots of things can go wrong with this disease. We think it's probably the more severe you are, the more likely you are to have them. But even asymptomatic people have to be wary. Of course, if you're asymptomatic and then you start having symptoms, well, you're no longer asymptomatic. So at that point, we'd say you've got something going on, Hawkeye. What do you think?
Yeah, I agree with you. I think that the concept of asymptomatic and then suddenly 3 or 4 weeks down the road you develop symptoms, I think that's a difficult concept for me to understand. So we know that you can have changes in your body based on radiology, meaning either CT scan of your lungs or MRI of your heart. We know that even people who are asymptomatic can have those changes. It's really difficult to know, though, whether those changes mean anything, because just as you said, if you're having a symptom, then you are no longer asymptomatic. So I think more to the point, just like you mentioned, if you have more severe disease or moderate disease, you're probably more likely to have some of those complications on down the road. But once you have a symptom, you are no longer asymptomatic, so you aren't in that category anymore. If you have mild to no symptoms, they probably won't worsen down the road. You are certainly going to be at risk in the acute time for those things like blood clots. But other things, we know that people say, well, I lost my sense of taste and smell, and that can linger on, and that may be somebody's only symptoms. We know that can linger on for weeks as well. So, but again, once you do have a symptom, you are no longer considered asymptomatic. So,
David, in your emergency room, are you seeing young people who thought they were asymptomatic and then get sicker?
Yeah, actually we are. Speaking back to that graph, it has a graphic that shows the first wave tail ICU folks. So that green line, the red, the first wave tail post ICU recovery. We're actually seeing purple. A lot of people who are that curve is not going all the way down. It is staying rather flat and higher, meaning that we've all seen in my group numbers of people who've had a COVID infection and they're maybe still feeling a little tired, fatigued. Mm-hmm. I've seen a number of people who have had a persistent cough and they wonder if it's gone. And I mean, these are individuals who, in my experience, have been tested positive perhaps a month to 6 weeks earlier, and they still don't feel quite right. Many of them admit that a lot of things are back to normal. And so, once again, back to that fourth wave, they're experiencing a lot of psychic concern about, am I still sick? Can I still infect anyone? I'm not quite myself. And even may I not, or do I not have kind of the energy I once had? I've had several people who I've, out of concern and abundance of caution, retested, and I'm glad to say a number of them have turned up negative. So I don't know completely immunologically where I would kind of put my pin on whether they've had a complete response and are now immune. But I think I've had some gratification in telling people, wow, at least right now your test is not positive. Some of these effects perhaps are lingering, and just keep being hopeful and going forward and following up as has been prescribed by your physician. So, we're seeing a lot of concerns of the post-infected. And I will say the last thing is that many of these folks are not, I haven't seen a ton of the people who are at their sickest returning to the emergency department, the ones who perhaps had an ICU stay and needed all of the advanced therapies that KU and the CDC has said are good things. So it's been an interesting time.
Yeah, no, I think that's a good point. And even in studies that have been done, such as even with the common coronavirus, the really definition of asymptomatic can vary between studies. We have to note that asymptomatic means really absence of all symptoms. Just as you said, as you look back and people are discussing it with your provider, you may be like, oh, well, I actually did have this symptom. So that really negates the asymptomatic part of that. So hopefully that answered that question. Any other questions, Jill, or one more, or are we going?
Yes, we do. Yeah. We have one.
I think there we go. Hey, we're back with you.
All right.
Yay. Melissa is from Hayes. Can you hear me?
Yes.
Okay.
Yep, we got you. Hi, Melissa.
Melissa is from Hayes, and she read that the 7-day average positivity rate is 29.4%. And she wants to know, where is this uptick coming from, and how does it make you feel?
All right, let's turn to Heather for that question, huh?
Right. So the percentage has gone up, and there's a lot of factors to that. I mean, the numbers have gone up. So that's why they're starting to report a 7-day positive number, which is now 18, which had been as high as 30, but we had it even lower than that. So there is an uptick. But the other problem with the percentage is that our tests range from coming back anywhere from 24 hours to 10 days. And so when those all dump in, then it varies the percentage of the positivity. So there definitely is an increase in cases that we're seeing. It is a little confusing. A lot of those are in the nursing home population. We're seeing an increase in that group as well. And so that's why they've gone to getting a better kind of feeling of what the number looks like. And we're at 18 a day right now. And so hopefully we'll see a trend lower than that here over the next week. And how does it make me feel? Well, we just know that the virus is here and that people need to keep being serious about, the social distancing and the hand washing and the mask wearing, so that we can continue to try to keep the best, handle on the number that we can. As long as people, continue to try to live and move around, which we need to, we're going to keep spreading the virus. So we just have to keep doing the best we can.
Heather, it feels a little like, and so correct me, both of you, Heather and Eddie, if I'm wrong, but initially it was in China. No, that's in Italy, your problem. No, New York and so whatever. And then it was like, well, it's Kansas City, and now it's like, well, that's not out here in Western Kansas. It's like, we're far removed from all that. And now it's everywhere, including right here. I mean, for you guys to have 15, 16, 17 patients, that's a big number, and I think that there was a time earlier in this week when you actually had more people hospitalized in the acute phase than KU did.
Yeah, I think we were tied almost.
Yeah. And that's crazy. So it is everywhere, and people have to realize that COVID-19 can be bad. And the truth is, most people survive, most people do okay, but it's not influenza. People do get really sick, and a lot more people die with COVID-19 than they do with influenza at least since the pandemic in 2018 and 2019.
Right, and we're seeing it even in those very small rural towns, which I think probably initially we thought, they are still safer just because they're less volume, but at the same time, maybe they're not being as careful because they are smaller communities.
Yeah.
So not one town has escaped the virus as of today. So
I think that's really important, and we're all seeing it. And Eddie, I so appreciate your comments earlier that you feel like that the community's rallied around it. Do you think that's also happening out where some of our safety net hospitals are, or our critical access hospitals are?
I would say probably not to the extent that we experience here in Hayes. I have kids that are in some sporting events with soccer, and we see that it's outside and everybody social distances, but then as we're traveling to those places, we'll stop at quick stops to fill gas. And there's times where we walk in and we may be the only group that's wearing a mask, besides maybe the person behind the counter. So I would say that it's probably a little less diligent out in some of the more rural areas, to be honest with you.
And here's what I would say as we start to wrap up the program today. First, I have a core set of political beliefs. They're pretty staunch beliefs. But when it comes to healthcare, that is apolitical, folks. And when you come see me or Heather or Dave or Dana, or you're here in Hayes, you're out there in KU, the reality is when you come in, you're a patient. And it doesn't matter what your political or religious or ethnic or any other racial beliefs or background is. We are here to take care of you. And our job on this presentation and our media thing, the reason we've been at it for over 100 days, is we're trying to take care of you. And we're trying to give you a message of how to stay safe at a time when there's a lot of rancor and there's a lot of false information and there's a lot of baloney out there, frankly. And so what you got to do is listen to the people that are trying to keep you safe. Because then you can make an informed personal decision about what you're going to do to stay safe for yourself, your family, and all the folks you love, and your community. So Dana, as we wrap up the day, final thoughts this morning?
Yeah, I agree with you 100%. We are doing this because we care about people. We care about the science and the medicine. It has nothing to do with political views or anything like that. We try to present the most up-to-date and accurate science. I was watching a show with about Albert Einstein and Stephen Hawking yesterday, and one of the reasons that Albert Einstein had to leave Germany was because there was a huge pushback against science and a debunking and believing that science wasn't needed and wasn't working. Follow the science. We are trying to follow the science. Everybody from Dr. Birx and Dr. Fauci on down to us who are treating patients every day, and Dr. Lisbon, who's in the ER every day with people who are coming in with acute illness. We are doing it because we care. We want to continue to provide that most up-to-date and follow the science, and that is the way that we are going to be able to get out of this. Continuing to follow the science, doing the most accurate and best practices to help protect ourselves, our loved ones, and the rest of the community.
Yeah, so true. Dave Lisbon, final thoughts.
I would, of course, urge everyone to remain hopeful. I think that my wife helps me with this, and she adopted what is the new normal a while ago, and I was a little resistant. I was like, oh, this will be over. But, so I think I would encourage both myself and others to think about a thoughtful new normal where, because humans are social animals and we're the better for it, we just have to be thoughtful and careful about our gatherings. We have to, at this point in the evolution of this pandemic, really rely on what can be thought of as the simple things, the public health things that we know work. So really wearing those masks, keeping that distance, being, again, very thoughtful about the large gatherings. And again, we are confident that science will bring an answer for us for this pandemic, and that that the community will pull together to do what's best. And I want to thank the community for being very patient with us in emergency medicine. Our volumes are back up again, and I do applaud and continue to advocate that if you've got a series of chronic medical conditions and you think something is awry, please come. We have the facilities and the wherewithal to separate and keep you safe, as well as take care of your medical problems.
And Eddie, I know you guys are keeping people safe in Hayes. You've separated. Final thought, you've separated. That sounds terrible. You've kept the people safe by, cohorting your COVID-19 patients and things. Final thoughts for your community and for here in Western and Central Kansas.
Yeah, I think it would be, like everyone's saying, continue to stay diligent. It does wear on you, and it does become tiresome, but at the same time, it also becomes kind of the new norm, in the fact that there's times I forget I had my mask on until I go to try and put a piece of food in my mouth and I realize I still have it on. So we'll kind of settle in on that, and I think that continuing to make those smart decisions, look to see if it makes sense to get in those big groups. Weddings of 500 people in an enclosed space probably don't make the best sense at this point in time for our communities. So just continue to do that and make good decisions.
Heather, final thoughts.
Well, first of all, thanks for coming out to Hayes for the show. It was a lot of fun. We're just here to take care of people. That's what we do every day. I think we do a really great job of it. And, keep doing your best. And I agree with some of the thoughts today. People are anxious. People are sad. You just have to find your new focus, whatever that might be. Change is inevitable. I've planned and canceled more activities in the last 4 months than I ever have in my life, and I don't like that. I'm a planner. So now I'm just ready to change it. My weekend plans, I had several things I was supposed to do, and now I don't have to do any of them. So maybe I will swing a golf club a little bit more this weekend. I think we just have to be more nimble and be patient.
Yeah, I think that's a good message. Hey, Thursday, back in the studio in KCK will be Patrick Salee, the CEO of Vibrant Health, and Julian Van Loo, who's the director of the Unified Government of Wyandotte County and KCK Public Health. Together, they're going to talk a lot about how the virus has spread in the dot, including the death toll, which continues to show significant racial disparity. A couple of slides looking at some great masks. This reminder from Mia, who wants us to know that everything is going to be okay. Please wear your mask for each other. And then this one from one of our new cancer surgeons, Lindsay Kilgore. She recently came to KU after completing her residency at MD Anderson and is now practicing in her cancer center. These are her toddlers who proudly wear their masks to keep others and their mama safe from COVID-19. You know, it is about keeping each other safe. And Dave Lisbon, I loved what you said about your wife. I know your wife, and your wife, my wife, they kind of grew up together. And I will say, I think my wife's done a great job at helping to keep our family safe as well. And you know what? Isn't that the message? Isn't that the right thing? That we work together, we tell the truth, we have an honest, real conversation, and we work to keep each other safe. That's how we get through this. And we can do it because we know when we follow the pillars of infection control, we can stay safe. I'll be on the road for the next few days. I'll try and check in periodically, back in the studio next Thursday. But you know, be staying safe. Be wearing a mask wherever I go. And I'll try and send some photos along the way about what I'm seeing out here. Because I think we're going to find that people are starting to get that message and they're starting to wear their masks. Because we are going to do this. We're going to get through COVID-19. We're going to do it together. We'll see you soon.